Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1 minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. We're super excited to welcome back Jayden and Aubryn, a psychotherapist, consultant, and personal trainer. They appeared on the first time telling us all about somatic health, their entrepreneurial journey, and what it's like to be their patient. Today, we're going to be talking about sexual health, specifically the definition, how they help people identify their level of satisfaction when it comes to libido, common complaints or concerns, identifying the core, particularly when it comes to trauma, and sex versus intimacy. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. We hope that by watching on YouTube and listening to your favorite podcast app, you'll feel empowered to ask questions, educated on how you can navigate the healthcare system, and confident to manage your health at home. If you haven't already, we invite you to subscribe either to the YouTube channel or the podcast, hitting the thumbs up, the subscribe button, the bell, the star, whatever is out right now that allows you to be subscribed and notified so that when you sign on to that app or YouTube, you'll see right away on your subscription tab or in your library that we've posted a new video, or you can go back and watch the old ones. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're having a medical emergency, you should seek medical guidance from your healthcare provider. If you're having a physical emergency, you should call 911. If you're having a mental health emergency or you know someone who might be, you can call 988. Jayden, welcome back to the Melanin Initiative.
Thanks for having me back.
So everyone will have to go back to the first episode to hear some other things about you. But this time, tell us a little bit about what you do when you're not working.
Oh, what I do when I'm not working, I mostly dance and read. So I'm a choreographer, and also just like dancing is my main way of expressing myself. I think it's very funny that I'm a talk therapist by trade, and I don't really like talking that much. I'm not always that great at expressing myself the way I want to when I'm talking about deep emotional stuff, and so that's what dance is for me. And then a lot of reading. I'm a huge nerd, so I'm always just like consuming information, fiction and nonfiction.
Okay, so this is a good question. Are we doing audiobooks or we're paper hardback?
All of the above. So behind me, for people who see the videos, my little library. I spend way too much money on actual books. I'm on a current, like, I'm not allowed to go into bookstores at this moment in time. Um, but yeah, and then when I'm not reading a physical book, I have audiobooks. But then it's like, oh, but I'm also listening to podcasts. So you gotta divide the time appropriately. It's a whole thing.
You're in my life right now. So since you like podcasts and we are a podcast, what's one of your favorites?
My favorite is the podcast that got me into podcasts, which is Ologies with Ali Ward. And every week she goes over a different ology, and it can be anything from like the study of bears to the study of trains to the study of, you know, relational psychology to, gut biomes or beauty science. I don't know. It's so fascinating. And then you get to be that person where you're like going on a walk with someone. And you're like, hey, did you know this fact about feathers? Or did you know this fact about mosquitoes? Yeah. And
I know someone like that. I'm just like, how do you know this information?
yes, it's great. Highly recommend.
So before we get into our questions on sexual health, let us know a little bit about your background when it comes to your education and training and all those credentials behind your name.
Yes. So I have a master's in social work. And so part of that is systems training. So if you ever wonder, like, what's the difference between a counselor, psychologist, or social workers are trained in systems theories, which means we learn about how the person affects the environment, but then the environment also affects the person all at the same time. And if you change one part of a system, so like if the mom in a family is struggling with substance use and then she like gets clean, well, that actually, even though it's a positive change, can affect the whole family system. And so yes, that's systems theory in a nutshell. And I am an independently licensed clinical social worker. So my specialty in school was clinical social work, i.e. therapy. Then I'm also certified in school social work, dialectical behavior therapy, integrative medicine providing, and personal training.
Ooh, that one, dialectical.
Mm-hmm.
What is that?
Dialectical behavior therapy, or DBT for short. This was a modality that came as a response to cognitive behavioral therapy, or CBT, where CBT is very much like, oh, you're feeling anxious because you're thinking anxious thoughts. So uh, let's change your thoughts so we can then change your feelings.
Mm.
Dialectical behavior therapy is like, you're feeling anxious, and you're probably just going to feel anxious about this thing until we change your thoughts about it. So in the meantime, how do we manage the anxiety? And so it was originally made to treat people with borderline personality disorder who historically, like they have a lot of emotional reactivity and emotional dysregulation and struggle with interpersonal relationships and communication skills. So it's like, okay, you're really angry at the person in front of you. How can you express your anger in a helpful way rather than punching them in the face? And so a lot of skills training and a lot of communication skills there. And, that's the OG like backstory of DBT. You can use it for many different reasons and for different diagnoses. But yeah, I'm really big in skills training, so got that certification.
Wonderful. And thank you for explaining that too.
Yeah.
So you're here to talk about sexual health. How do you define that?
I've been thinking, I knew you were going to ask me that. And health is such an interesting thing to try and define because everyone defines what's health for them. Like everyone has their own definition of health. And so when I'm thinking about someone's sexual health, I am wanting the client to actually define that and then for me to help them reach those goals, making sure that whatever they have defined is more helpful than harmful. So if their sexual health goals are to, coerce as many people as they can into having sex with them, okay, well, that's going to be more harmful than helpful. I'm not going to call that one a health goal just because the client does, right? But usually it's being satisfied with your libido, being satisfied with the type of sexual activities and sexual relationships that you're able to have, feeling like you have autonomy over your body and the things that you want to do and that kind of stuff.
Wonderful. And so, yeah, when we chatted before, this, when we were brainstorming about this show, you talked to me about how you help your clients identify their level of satisfaction with libido. So tell us, walk us through what that's kind of like.
Yeah. So this is one of my intake questions, and I'll ask, are you satisfied with your libido? And usually there's a look of panic and horror because most providers have not asked them that question. They're like, what? But yeah, then usually I'll just ask, do you feel like your libido is high, low, average, and they'll usually give an answer, and then I'll ask if they're satisfied with that. So some people will say, oh yeah, I think I have a lower than average libido. Well, that's not a bad thing. I'm not going to just check they have low libido, right? Like, are you satisfied with that? Because there's a whole spectrum of sexuality. So want to make sure people who are on the A spectrum are like being heard and not pressured to do things that they don't want to do. And also sometimes people just have priorities other than sex, and that's okay. And also sometimes people with really high libidos are like, this is completely disrupting my life. Like, I help, right? And so I don't want to be like, oh, you have a high libido, cool, everything's fine. Like, that's not necessarily true. And so based off of what they're saying, I'm like, how are you rating your libido, and where would you want it to be, and why? And then kind of going from there.
I like how you gave perspective on the spectrum and how it's not necessarily good or bad. It's really relative to the person and their needs and kind of desires. Another thing, the libido talk. So yes, we're all trained about how important it is to ask those questions, but evidence shows that we're not talking about it, right? And then sometimes patients don't even know they're supposed to talk to us about it because we haven't demonstrated that that's even a priority. And particularly when you're talking about that 15, 20-minute visit, there's no way it's coming up if that's not why you came here, right? And we know for a fact lots of medications affect libido and sexual performance, and we know that. But we don't always tell the patient that, and we expect them to tell us that that's a problem they're having so we can adjust their medication, particularly when it comes to like high blood pressure, even some psych medications. We know that there's other options we can try when the patient has that experience, but if we don't bring it up and the patient doesn't bring it up and they just stop the medication, because it's a priority to them to maintain this level of libido or sexual performance. So you're totally right about that. And even though we're all trained, it still comes down to the individual provider's level of comfort, confidence, comfort, and education, because if I'm not comfortable talking about it, I'm probably not going to bring it up.
Exactly. Yeah. And I have had clients tell me that their previous therapists have said that they don't feel comfortable talking about sex in therapy sessions, which blows my mind as someone who has been trained, and also is like, yeah, that kind of checks out because there's a wide spectrum of provider competence out there. But yeah, these are experiences that people are having. And also, if we just kind of take the societal comfort of talking about sex and sexuality, like that baseline, if the provider is at the societal comfort of baseline of talking about sex, that means they're probably not that comfortable about it, because in general we're a pretty repressed society sexually. Like, we whisper. It's like, so how's your libido, right? Like, it's a dirty secret to be talking about, right? Like, so is your lubrication okay? Like, why are you being weird about it and using like super clinical words? Like, do you feel like you're getting wet enough? Just say that, right? And I think that the more that I'm able to model and other providers are able to model, just like, this is a human function, let's just talk about it, then just exactly what you're saying, then the more comfortable the client is with bringing it up.
Yeah, because we want them to have credible references, right? And people they can talk to. And if we don't do that, they're just going to go to the internet. And all of us tell them how bad the internet is, but then we don't replace how bad the internet is with credible resources.
Mm-hmm. You preach it now.
Yeah, and then people will think that there's nothing that they can do about it. Oh, well, I take this medication. I have to take this medication for this disease that I have, so there's nothing I can do about it. Oh, I'm this age, so there's nothing I can do about it. Oh, I went through this thing, so there's nothing I can do about it, so I just live like this. And that can then lead into anxiety, depression, isolation. And then we start to address those problems over there, but we never got to the core, or at least one of the initial causes for that anxiety, depression, or isolation.
I think a really important thing building off of that is this idea that we are not taught to think creatively about our lives. We are often taught like, this is the path your life should follow, right? Whatever that path looks like, whatever you're told, we're taught like there are certain ways to engage with the world and there's certain things that you should feel and certain ways you should behave. But at the end of the day, all you have to do is die, right? That's the only thing that is mandatory in this world is that you die. So everything else is an option. And when we get to choose, like, you know what? This is not the libido I want to have. These are not the types of sexual relationships that I want to have, right? This is not how I want to feel inside when I'm engaging with in these certain activities. If we just make that an option, right, then the next step is, well, then how do we get there? But without it being an option, right, we really limit ourselves, we fall into black and white thinking, and all of that thinking process is going to exacerbate anxiety and depression as well.
Yes, and so we've talked about it quite a bit. We haven't given a definition. How do you define libido?
Libido, I would define that as your sexual desire, or yeah, your desire to have sex. I do think that I like to sometimes distinguish between like your emotional libido and like your physical libido, because sometimes people are like, yes, I'm like very much mentally and emotionally in the mood and want to have sex with you, and my body is not doing the biological components that I want it to. And sometimes it's vice versa, right? It's just like, I know I'm on testosterone. When I first started taking testosterone, my body was just like high libido all the time. I'm just like, I can't get anything else done because my like physical libido is so high and it was annoying, right? I was like, I don't want to be feeling sexual attraction to anyone around me right now. And so I like to distinguish those two and then figure out where we want to make adjustments.
Wonderful. So what are the most common complaints and concerns that you hear?
The most common complaints and concerns are probably about pressure. And feeling like they need to perform a certain way and then getting anxious about not performing a certain way. Their partner didn't orgasm within a certain amount of time, or they felt like they should have orgasm at this point in time and now they're getting in their head. The other thing that I hear a lot is getting distracted. I work with a lot of neurodivergent folks, and I think it's actually quite common that people get distracted during sex, not because the sex is bad, it's just you lose attention. So dealing with that, and then a lot of trauma, either like sexually related trauma or a lot of religious trauma, saying that, what you're doing is bad for, whatever reason that is bad. And you are a bad person for like having these desires. And so working through that.
Really good points there. So yeah, let's get into that. I love the fact that you're able to talk about this from a trauma-informed lens, because yeah, typically I would say the conversation about libido is all circled around pleasure and more not kind of gender specific, but there's no trauma associated with that. And I love that you brought up religion too, because that is it plays a really huge role, particularly when you're raised to behave one way and then, with the switch of like a wedding, you're expected to now behave completely different without experience, information, confidence, support, things like that. So yeah, how do you help patients identify the core from a trauma perspective?
So usually I kind of focus on what is happening, right? Like what are the internal experiences, the thoughts, the feelings, the sensations, the lack of feelings or sensations if you're dissociating, kind of noting if people feel like they need to use drugs, get high or drunk or whatever to be able to have sex, that kind of stuff. And then I was like, well, let's just try this other thing, right? I'll just give them one thing to try, this little opposite, see what happens. Usually, like, so for instance, person feels like they need to smoke weed in order to have sex. Well, just try having sex without smoking weed. See what happens. What thoughts comes up? What feelings come up? And usually, the thoughts and feelings that come up are going to be trauma related, right? It's going to be like, oh no, like I'm starting to feel like squirrely in my body, like this is bad, this is wrong, I'm getting in my head about this, and why can't I just have sex like a normal person? Is there something wrong with me that I can only do this like when I'm high? Like all of those thoughts, and then we usually start to explore those, and there's some underlying trauma that gets revealed, and then we can kind of talk about it from there.
And we started this conversation talking about books, and I'm a big book reader too. And it came as such a surprise, especially when I was younger, and I would read so many books from different people from all different genres. But there was this really common theme of people getting molested when they were young, like over and over and over. Like it would always, the book wasn't even about that. But when they recount their childhood, it just kept coming up so much. And it was really heartbreaking and eye-opening that so many people experience that kind of trauma. And I don't think there's always a space for that conversation, particularly, especially, I mean, if you go to therapy, it certainly might come up, but outside of that, certainly when I engage with patients, that's not coming up, it's not being addressed.
Yeah, and most people don't know how to handle that conversation. I think as providers, and at least as a therapist, I was taught very specifically how to respond, or ways to respond in an empathetic, warm manner, or just kind of depending on the goal of the conversation, how I'm going to respond is going to be most helpful to the client. Most people don't know how to do that. They were not taught how to do that. We're not really taught communication skills in school. And then if the person you're saying that to also has a history of sexual assault, then that might be actively triggering for them. And now they're having a trauma response and they're not going to be able to show up for you as well. So I think it does make sense that, people as a whole are not able to respond effectively to that. I think the answer would be to teach these types of communication skills much earlier. Um, but yeah, I think it's hard when there are only a few people that are often inaccessible and expensive that can effectively have these conversations. It just really enforces that it's this very stigmatized thing and it needs to be siloed away until you can speak to a specialist about it.
Mm-hmm. Yeah, because even we know sometimes people do go to a loved one, and unfortunately, that loved one is not receptive, particularly if it's a trauma that occurred in the home with that loved, a partner that they are intimate with or have a very close relationship with. There's a tendency for them not to believe the person who underwent this assault or trauma, and then they're even sheltered even more, because it took so much to even come out the first time and even share this, and then not be believed is almost like re-traumatizing.
Definitely.
Do you know if they're teaching sexual health or education still in schools?
I think it depends on the school district. Uh, I know that in the Seattle area where I am, yes. I believe for public schools, in general, yes, but then the type of sex education depends, right? It still might be abstinence based, depending on the location. And then, with charter schools and like vouchers becoming more popular, and there's no regulation of sex ed there at all. So, uh, I think there's a big shift happening right now about like access to sex education.
Yeah, I'd be really curious, anyone watching who might know, because if trying to recall my own sex education in school, it wasn't about like, what they call bad touch. That didn't come from school. Yeah, I think you're right. It was a kind of a church and school was around the abstinence, because I think there was even like a pledge to sign. I signed the pledge, actually, yeah. And so yeah, there was the talk about abstinence at church and at school, but the bad touch came from home, right? If you're going to go to this friend's house, if you're going to go out and their dad's going to be there, whatever the case is, if you go in the bathroom by yourself, people shouldn't touch you here. So it was kind of that bad touch. But then and then you should tell me, right? Tell if that happened. But certainly there's room for more information and how to navigate that, especially because the kid is often, especially if you're a kid when this happens, they're threatened not to say anything, and they don't.
Yeah, and I think it's part of this, part of the reason I think schools struggle with providing the proper education is that there's this really big emphasis on like PIV, so penis and vagina. I don't know if we can say that. Okay, cool. Yeah,
Everybody.
penis. Great. I just know like some podcasts, but yeah. So like penis and vagina, and then like orgasm, right? Like that is what sex centers around, and there's so many other things that fall into sex and sexual categories. Like the briefest awareness of queer sex, um, like starts to tap into that. And then I think, also intimacy and other sexual related activities that come with their own varying degrees of risk that someone might do because they're like, well, at least it's not sex. And we're just like not taught at all to navigate that. There's a lot of judgment around various types of sexual activities. There's a lot of misinformation, and it's just when we have these narrow views of things, it's usually just not helpful.
Wonderful. So you helped me out a lot. So like I said, I closed this show with Alicia and Geraldine. The three of us are three Black cisgender women. We identify as being straight women. And so we always want to make sure we're thinking about people who aren't sitting at our table. And we're trying to think about those vulnerable communities. And so for us, those vulnerable communities include children, which we've touched on a little bit here, older adults, which we touched on a little bit here. And you mentioned the queer community. And so if you could just kind of explain to our audience what that entails.
Yeah, well, I think that when we're looking at queer sex, there's a lot of things to consider trying to decide what your thought, trying to decide where to start. But if I think like male bodies on male bodies, do you know how to douche? Do you know, yeah, generally the proper cleaning? Because you can over clean your if you are like doing a lot of sex, right? Like, are you aware of the risk of like eating someone's and then kissing them, right? That's just what is happening, right? Are you on PrEP? You're aware that HIV has higher transmission through sex, not through gay sex, through sex, which straight people also do, right? But if that's the case, right, like, are you on PrEP? Are you using condoms? Um, do you understand like how to size up if you're starting to get sex, right? You don't have to start with the size of a penis. Like that can be quite large, right there. Like you can work your way up to larger sizes. Where's the appropriate lube? You might want to use different types of lubes for different activities. If I'm thinking about two, female body people together, right? I think a lot of people just assume that we're automatically going to penetration because people like to be very centered around penises, right? But like, are you aware of, the clit and the various ways to do clit stimulation? Are you aware that for female body people, there's not a G spot like that's accessible through the anus? So you can feel pleasure that way, but don't expect an orgasm that way, right? Like, are you aware of just like other erogenous zones, positions, again, the different types of lubes, the different types of toys and tools that you can use? There are a lot of options out there, and a lot of people go to sex stores to try and buy a toy and are very overwhelmed. So just kind of figuring out what works best for you and your body, understanding that people like different sensations. And then if you're getting into trans and genderqueer communities, right, you want to be really understanding that some body parts are off limits, right? Because that's going to be a very dysphoric experience for someone. So just because they have a body part doesn't mean they want it to be touched or to be used at all during sex. We want to have more negotiations about like if clothing is staying on, if someone's wearing a binder, don't try and make them take it off during sex. They may not want to. If like you're on hormones, like that can change like your lubrication and just kind of like the biological response that's going on. Just there's a lot more consent talks that need to be had. And I think that consent piece is also super relevant for people who have different abilities, right? If you have POTS or you're a wheelchair user or anything like that, like there's going to be modifications that you need to do. And all of that's fine. We just need to have information about it so you're doing it safely and enjoyably.
Thank you. And since we're on the topic of vulnerable populations, we also like to make sure we also make sure we're thinking of those considerations for people on the autism spectrum. And when it comes to trauma and being like kind of abused and victims sometimes, do you encounter that in your practice?
Yeah, for sure. I do want to separate like autism out from trauma because they're not, I think everyone has trauma as a trauma specialist.
Oh, okay.
Um, but I know that there is like an overarching narrative that trauma causes autism, and so I just want to be clear
Oh,
that like that's not what I'm saying. Uh,
I didn't
yeah,
know that there was people were thinking that.
yeah. People
Oh,
have interesting thoughts about autism,
oh, kind of like when kids are mute and stuff like that.
or just that like the reason why they're maybe socially different is because they've experienced some sort of sexual assault or something, or it could be like the mute as well. I don't know. I've just heard a lot of misinformation around there, so I just want to be like super clear that about that. But yeah, I think from a trauma perspective, it's good to just have conversations about what feels good and what doesn't feel good. And sometimes you don't know what feels good, right? Either because you haven't had the opportunity to explore or you're frequently dissociated from your body. And I think that's really important to communicate because then your partner needs to be consenting to doing that exploration with you, right? They may or may not want to be an active exploration. And if that's the case, then either don't have sex with them or understand like what are the parameters of sex that you do want to have with them, and then finding people that is safe to explore with. And not every time you have sex needs to be exploration, right? Like sometimes it's just for funsies. So always active consent and communication about things. I think with autism specifically, and I think a lot of other people experience trauma and other neurodivergences. Sensory things are really important to keep in mind. So some people have a really hard time focusing if there's music playing. Other people need the music to focus because it provides like a sensory baseline for them, and then they can go ahead and just actually put their attention on the experiences that they're having. I think there's also things like sensation play of like wax or whipped cream or bondage or any of those things, impact play, right? Those things might really heighten or completely ruin the experience for someone. And so don't just pin someone down if you haven't had a conversation about like how that amount of pressure is going to feel on their body. Um, and then, I also think that communication, especially with someone who's neurodivergent and autistic, right, like super important because there's a lot of like, this is what you said, so this is what I'm expecting. And if you venture from that, there's going to be some issues. And worst case scenario, there's some big issues and it's a consent violation. But even on a lower end, like the person's like, I'm confused about what's happening. We didn't talk about this. And now they're in their head and they're not in their body, just enjoying what's happening. And so being clear about the things you want flexibility on and being clear about the things that, like this is exactly how I do want it to go. And please don't deviate from this is all really important.
Thank you. That was so informative. Earlier, you mentioned the kind of spectrum of sex. And so, how do you distinguish sex versus intimacy?
Yeah, so sex again is like one of those things where a lot of people will define that differently. It's always really fun when people go to school for like marriage and family therapy or like they're getting their sex therapist certification. Like that's like how do you define sex is a common question, and then everyone's like, crap, no, I'm excluding someone, or like their brains always like explode. But I think generally speaking, a lot of times it can involve genitals or an exchange of bodily fluids. Um, I know it's not completely inclusive, but broadly speaking, um, when I'm thinking about intimacy, I really am thinking more about that emotional exchange. So you can have emotional intimacy with a friend, right? And you could also be in a sexual relationship with that friend. you cannot be in a sexual relationship with that friend. There's a lot of partners that I see, a lot of couples who they're really struggling with having sex, but that's because they're struggling in their relationship in general with expressing intimacy. They're not connecting and sharing that like emotional intensity with one another. So in those circumstances, I like to focus on building up the intimacy, and so that can be through like action, like, cooking them a nice meal, giving them a massage. It could be words of affirmation. It could be just like having, like, dressing up and sitting and having a nice dinner, at home, or even just like popping some fancy popcorn and watching a movie at home and having a little date night, or just having deep conversations, while cuddling. And I find that when we focus on intimacy, sex can also often be a side effect.
Oh, the side effect of sex. I love that. The side effect of intimacy. That's a good book title. Have you written any books?
You know, I started the NaNoWriMo, like the little writing challenge in November that happens to write a book on managing anxiety. And then as soon as November ended, I stopped writing it. So one day I will write multiple books. I have my whole life ahead of me, though.
Well, take that title, The Side Effect of Intimacy.
Okay.
I like that. I like that a lot.
Write it down.
Yeah. And then, those conversation cards?
Mm-hmm.
You should do those.
Yeah.
Because they're fun. There's a whole lot of them, but I don't think they get into this kind of conversation.
I'm noting all these things. I just like have a running tally of like every like thing I want to do with my business, and my ADHD brain comes up with a lot of them, and I'm like, okay, calm it down, make a plan.
Yeah, it was really very, very, very informative. I really appreciate that. I learned a lot. As we sign out, and I think you demonstrated how to have the conversation for a lot of people, certain things to think about them for themselves, right? Just where they're at, and then how to engage the people in their lives. So as we sign out, what are 3 ways that people can start that conversation, whether it's with themselves, their provider, or their partner?
Yeah. So, number 1, I would recommend a book called Pleasure Activism, because I think it can be really hard to start the conversation if you don't have a lot of knowledge. Like, you don't even know what to say. So, like, if you want to gain some knowledge for yourself, I do recommend that book, and it has a lot of fun activities in there. I think number 2, it would be if you are having any dissatisfaction or satisfaction, whatever your experience is with your libido, I want you to write it down, right? What is your experience with your emotional libido and your physical libido? And then 1 out of 5, right? How would you rate that? 5 being the most satisfied, 1 being like absolutely not satisfied at all. And once you write it down, it can be a little bit easier to say. And even if you don't feel like you can say it to a partner or to your provider, you can hand them the little thing, send a picture, send it on your little provider portal. And thirdly, the third thing I would say is to make a game out of it, right? So I would challenge you to engage in something that is sensual, sexual, intimate, like whatever you want, and say no genitals involved, at least for the first hour. I don't know how everyone, however much time you got, right? Like set a time. Can't be less than 20 minutes though, because that's too easy, right? And say, we're only going to, touch our bodies in this way for this amount of time, or like I'm going to challenge you to not make any noise, or I want to, find your most ticklish parts, and so we're going to go through or I want to like really give you some good head pets, right? Whatever it is, make it a game, make it fun, make it goofy, laugh. Laughing during sex is one of the best experiences. And just kind of take the pressure of an orgasm off the table, right? So you can really just focus on what you're doing.
That was wonderful. I appreciate you sharing your expertise, particularly going into our vulnerable communities, because just because someone has been practicing for a decade, just because they have a lot of education, as we mentioned before, it doesn't mean they're comfortable with every topic. And we want people to have credible resources and people they can go to that are going to create a safe space and an inviting space. And I think you demonstrated how that can be done.
Oh, thanks.
Do you want to tell people how they can connect with you?
Yes, for sure. So my business is Tice Consulting and Therapy. That's TISE, and consistent across all platforms. It's my Gmail, my website, Instagram, TikTok, and my Patreon. So Google Tice Consulting and Therapy, and I will definitely come up.
Wonderful. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, subscribe to our YouTube channel or on your favorite podcast app. Leave a message when you get there and share the show with your friends. It really helps the algorithm see that this information is important, and it'll make sure it gets to the people who need to hear it. You can find all of our social media links, how to connect with Jayden, and how to connect with us, and all the resources we brought up. So the book that they mentioned will be down there, and anything else of importance, we'll put it there for your convenience. At the time of this filming, we are releasing new shows on Sundays at noon Eastern on YouTube, and usually we drop the podcast at 5 a.m. if you're watching. We thank you, Jayden, again for coming on and sharing your time. While we're filming this, you're in the process of getting married and taking off to Spain. We wish you well. We'll keep you on our prayers. If you ever want to come back and share a new endeavor, the doors are always open, especially when you come out with that book, The Side Effects of Intimacy.
You'll be the first to know.
Thank you. We thank you, and we thank you, everyone, for watching. We'll see you next time.